Hello everyone, Dr. Beth here, and welcome to another episode of The More You Know. For the month of October, we're covering diabetes, and this week we're going to focus particularly on cardio or endurance kind of exercises. So we know that regular exercise helps to prevent the onset of diabetes. If you have diabetes, it also helps to prevent the progression, and it can even reverse the progression of the disease, which is so fantastic. So how does exercise help? Well, in particular, cardio helps to increase your insulin sensitivity. So remember from last week's video that diabetes is caused due to insulin resistance, or the inability of the body to use the insulin that's there. Exercise increases the sensitivity of insulin, meaning your body is better able to utilize the insulin in your body to pull that sugar out of your bloodstream, put it into the muscle cells where it's supposed to be so that it can't cause damage to the rest of your body. So the body is able to better use this mechanism. Another benefit of exercise, especially when we're looking at cardio, let's think about taking a nice brisk walk or jogging in the pool. You're constantly moving your body, meaning that your muscles are contracting and relaxing over and over again for a specific amount of time. This is really exciting because when you're contracting your muscles over and over again, like you do doing cardio exercise, your muscles are better to take the sugar out of the blood with or without the presence of insulin. So even if the body is having difficulty producing insulin, like it does later in the disease, your body is able to better pull the sugar out of the blood just by doing regular exercise, by getting your body moving. And the great thing about this is the benefits don't just happen while you're exercising. It's been shown that up to 24 hours and even longer after an exercise bout, your body has that increased ability to pull the sugar out of the blood more effectively just by moving your body on a regular basis. Now, when we look at what the best kind of cardio is for managing and reversing diabetes, we do recommend high intensity interval training. So why do we do this? So high intensity interval training is very safe for aging adults. We know that there are not increased risk of cardiac events or musculoskeletal injuries by participating in high intensity training compared to moderate intensity training. But the benefits are that it really helps address that insulin sensitivity and it boosts it up more effectively than moderate exercise. The other benefits besides increasing the insulin sensitivity is it's going to improve your cardiovascular fitness and including the health of your blood vessels, which is one of the things that gets attacked when you have too much sugar in your blood. In addition, it's going to help you lose weight to further improve your insulin sensitivity. We know that fat is one of the underlying causes of what causes insulin resistance. And so it's not just the fat that you eat, which we'll talk about later, but it's also the fat that you wear. So if you're carrying around a lot of excess pounds, particularly around your abdomen, that's going to increase your insulin resistance. And by losing that weight, your body will become more sensitive to the insulin you're already producing. So I didn't go into depth on HIIT training in particular in this video, but if you want to go back to my February 20th video, it'll give you a more in-depth of the benefits of high intensity interval training for aging adults.